Injecting drug users have a much higher risk of morbidity and mortality compared to the general population. Accidental drug overdose is a leading cause of death in injecting drug users and contributes substantially to mortality in communities in which injection drug use is prevalent. In 2007, the rate of unintentional drug overdose death in the United States was about 5 times higher than in 1990. In addition, overdose mortality rates are highest in ethnic minorities. In the United States, overdose deaths are most common among individuals within African American or Hispanic communities, whereas in Canada, First Nations identifying individuals are more likely than others from the general population to die from an overdose. In the 1990s, Vancouver began seeing issues with drug-related harm. In British Columbia, HIV incidence of 19% and over 300 fatal overdoses among people who inject drugs was observed. This led to a state of public health emergency, leading to the opening of Canada's first supervised injection facilities. Supervised injection sites are facilities that provide a stress-free and sterile environment for individuals to safely consume pre-obtained drugs. Some key services offered include access to sterile drug use equipment, availability of healthcare professionals for overdose intervention, and STD and STI testing. In addition, other services include education on potential harms from drug use, along with resources such as mental health treatment, drug rehabilitation, housing services, and social welfare programs. In October of 2015, Canadians elected a new Liberal government under the leadership of Justin Trudeau, whose government had publicly expressed support for supervised injection sites. With a new government in place that expressed its support, and given the emergence of the opioid overdose epidemic, a number of municipalities began developing plans to establish supervised injection sites, and several initiated feasibility research. Montreal quickly moved forward with plans to open 3 supervised injection sites, and in February of 2017, they obtained approval from the federal government to do so. As well, the City of Vancouver sought federal approval for several additional facilities, including a women's-only supervised injection site. Other cities like Toronto, Victoria, and Ottawa soon followed. To date, there are currently 39 supervised injection sites operating in Canada. Substance abuse is a mental health illness that may result in many individuals frequently relapsing. Harm reduction strategies, such as supervised injection sites, aim to decrease the dangers associated with active drug use. By creating a safe, non-judgmental environment, they are able to facilitate safe injecting conditions, resulting in a reduced frequency of overdose and enhancing access to primary health care. Using criminal justice as a means to control addiction has been proven to be ineffective, as it has shown to increase high-risk behaviors and the risk of acquiring infectious diseases. Studies regarding supervised injection sites have indicated that these sites are effectively able to promote safe injecting conditions without promoting drug use or drug trafficking. In fact, results based on a research study in Vancouver demonstrated that injection facilities failed to attract crime or increase drug use, and on average prevented 35 HIV cases per year. A study conducted by Jozagi et al. Analyzed the implications of expanding supervised injection sites across multiple locations in Canada and their impact on Canada's healthcare system. With the use of mathematical models, researchers estimated that there would be a decrease in the number of HIV and hepatitis C infections as a result of the additional supervised injection site locations in Montreal. Thus, this would result in reduced health implications for users and minimal burden on the healthcare system. The addition of each supervised injection site, up to a maximum of 3, in Montreal will on average prevent 11 cases of HIV and 65 cases of hepatitis C each year. As a result, there is a net cost saving of over $600,000 for HIV cases and $800,000 for hepatitis C cases for each additional supervised injection site per year. As much as there are arguments supporting supervised injection sites, there are also many arguments against them. A 2019 study by Berry et al. Collected these opinions from 1,004 adults in the United States regarding supervised injection sites through a public survey. The sample survey rated all arguments that were against the legalization of supervised injection sites as stronger than arguments that were in support of the facilities. One argument that was rated highly by American adults who participated in the survey was that public funding is better spent on the treatment of addiction rather than assisting addicts with drug injection. Another one of the most highly rated opposing arguments from the study was that these supervised injection sites allow, and in fact encourage, individuals to engage in the illegal behavior of using drugs. Outside of this study, some argue that this sense of encouragement could even reach and influence young people who are considering becoming involved in drug use. Lastly, many believe that supervised injection sites could attract drug dealers and predators, therefore introducing other issues into these areas. Supervised injection sites have the potential to offer an important service to injecting drug users, since it has been shown that they promote safer injection conditions to reduce the dangers associated with drug use, such as overdose frequency and disease infection. However, there have been arguments claiming that allocations of funds could be put to better use by helping treat addiction rather than assisting it. In addition, it has been argued that these injection sites could act as indirect encouragement of drug use to others. Going forward, more research needs to be done to understand how these benefits and issues play into the effectiveness and necessity of supervised injection sites through assessment of their safety and efficacy. If you would like more information on supervised injection sites, be sure to check out the resources we have listed in the description below. Thank you for watching, and be sure to like and subscribe.